Hey, Deborah.
Hey, Katie. How are you tonight?
I'm pretty good. Cheers to you. I am so glad to see you.
Cheers to you. It's good to see you.
I know you've had a lot going on, girl. So way to be here. Way to make it. Let's have a good time together tonight. So
absolutely. I'm so looking forward to meeting these women.
Okay. So let's get to the part where we bring them on. So you know what we have been talking about around here, Deborah, because you're a part of this community. We have been talking about finding our courage and finding our voices. And tonight we are having women joining us whose voices are so important to hear right now because they're doctors and we're in the middle of a pandemic. Now, you guys, I invited me and talking with these doctors tonight because Deborah founded the Dr. Amy Acton Fan Club, which has 130,000 members in Ohio on Facebook. And Deborah, you founded it for a similar reason, right? About like her voice, amplifying it. You tell
Absolutely. Absolutely. You know, it kind of is a little strange to have a fan club for a public health official. But when I heard her, I knew her voice was so important and it needed to be amplified and we all needed to hear the message. And I just really wanted to figure out a way to get it out there as quickly as possible. And the fan club really was able to do that and it grew so quickly. And I think it's wonderful to be able to expose so many people to these other doctors doing great work.
Right, because here we are still in a pandemic. Amy Acton's voice needed to be amplified, and we need the voices of the women who are here with us tonight to be heard as well. So let's introduce them. Let's bring them on. Okay, so we have Dr. Rachel Morocco, who is a pediatrician. Hi, Rachel. You're a pediatrician. You're a mom. You're a professor. And you happen to be running for the Ohio House in a suburban district, including Delaware and Powell, Ohio. Did I get that right?
That's right. Yeah.
All right. And so we also have with us Dr. Anita Somani, also a mother. She is an OBGYN. Now, I love so many facts about you, Anita. One of them is that you led that rally at the Statehouse in support of Amy Acton. At the moment, we all needed to see that support from docs. So, and you were leading that charge. Thank you. You're also heading up Doctors for Biden in Ohio. And I also just think this is an amazing fact, too, that your dad actually had Amy Acton's job under the Voinovich-DeWine administration.
Yeah.
Right?
Life comes full circle, doesn't it?
Totally. Okay. And then we also have Dr. Beth Liston, who is also a mom. She is a doctor, an OSU professor of clinical medicine, and she is a state representative in the Ohio Statehouse. And she's representing the suburbs north of Columbus, including Dublin and Worthington. So, Rachel, your district is like a bit north of Beth's, right? But you guys are neighboring districts. Did I get that right?
Yeah, that's correct.
Okay.
Cool. Beth is my representative. I love her.
Oh, it's all connected, ladies. Yeah. So, and Beth is currently the only physician in the Ohio Statehouse. So, Dr. Rachael Morocco is like, we need to like get her in there here in 2020. So, Beth can have some company as a physician advocate. Am I right? Am I right about that, Beth?
Absolutely. We need Rachel. She is important and would bring an amazing voice to the Statehouse. So I'm very excited that she's running. I was very excited when she told me she was thinking about it because it's a long process and she's been doing this a long time. So we're almost to the finish line. I think 49 more days.
Something like that. So you guys, I mean, I think what is so interesting to me about the fact that there are actually, more doctors in the Ohio Statehouse and, the need for that is that so many issues that are coming up, always public health is always among us. But in the context of a global pandemic, there are issues that honestly, I never anticipated would emerge as political issues or partisan issues in terms of, protocols around being safe. Just wearing masks, maybe I'm naive. I didn't see that coming, but just having a, nonpartisan, clear-headed view towards how to handle pandemic. I think that was why Amy Acton was such an important voice for us in those early days, and why I know Deborah and I, as moms, just trying to figure it all out with school starting, like, hey, we're looking to you ladies. So Rachel, let's just start a little bit with you. I mean, what is it like to be a doctor in the midst of a global pandemic with all of this politicization of your profession, honestly, going on? I mean, how do you like even stay sane?
Yeah, it's a good question. Yeah, it's difficult. It's been really difficult. I mean, it's stressful. Every day is just different. And even medicine in general, I think, has become different. We in clinic, it's just a different feel. We've gotten used to our new normal, but we're definitely like not as interactive with the patients as we used to. Like, well, the best part of my job is like I get to pick up the babies and hold the babies.
Because you're a pediatrician.
Yes, that's what I love to do is, and play with them. But, now we're wearing a mask and glasses and the kids are crying at us and you're trying to maintain our distance. So it's been a little bit just different. And, it's just been stressful. I have a lot of patients who are asking me, like, do you believe this is a real thing? I mean, I've had that conversation with patients multiple times. And so it's been a lot. So
just as she juggles a child.
As she juggles, here's my little one here.
Hey.
So it's just been a very difficult, time, and everyone's just stressed out.
Yeah, totally. Deborah,
okay, go see that.
I mean, why not? Welcome. We need someone else in this interview, right?
Right. My son was trying to come in earlier, so the two of them maybe could get their own little room on the side and have their own conversation. I had a question for Dr. Anita, though. How did it feel sort of, we all in the Amy Acton Fan Club, as Amy was getting, attacked, from all sides and getting a lot of pressure? How did it feel to see, kind of the assault on public health? And
so
what were your thoughts on that?
Yeah. I think that it just shocked me. I think back to the 90s when my dad was doing the same job, and I can't imagine the pressure she must have felt to have people attacking her for what was her job. And that's happening all over the country. I mean, you look around, even the governor of Michigan was attacked for what she was doing. And I don't know if it's a misogyny thing that women are attacked more than men are in the same position, or if it's just that people are ignorant and they really think that their rights supersede the community's rights, But again, I look at this and I think, you know what? My sister's infectious disease, she was dealing with this in January. She actually sent her parents back to the United States because she thought that it wouldn't be an issue here, even though it was an issue across the world. And then as time went on and we all started seeing it, and I mean, Ohio was impressive. I mean, literally the Arnold Classic, if you all remember, they put that online. I mean, and there was so much pushback at that time. Like, why are they doing this? Why can't we go down there? And that was so prescient in a way. It was so impressive that they took a stand. The governor backed them. Everybody at that point was still it wasn't politicized. People were just going with the experts. And the governors were doing, Trump set aside Trump, but the governors were doing what they knew was best for public health. And then all of a sudden, it started getting politicized from the top. And when people ask me if COVID is a virus, I'm like, look at the international news. Don't just look at your own media. Don't look at your own Facebook feed. Look at what is going on around the world. I mean, we can all access BBC. We can all access international media, and you will know this is not a hoax. This is not political. It's not Democratic. It's not Republican. It's not going away come November 3rd. I mean, I hate to say it, but it's still going to be there. And I think that's why it's so critical to hear. I'm so excited to have another doctor running for the State House, because I think the more science and facts and people that create policy from an evidence-based standpoint, the better off we will be as society.
Yeah. Well, I just want to say too, like how proud I was to see the doctors in Ohio stand up in such, a visible way. There was, so many visuals representing sort of the attacks that you could see. And, you know, the Facebook page, everyone was just so glad to see all those docs on the State House lawn. It was really inspirational. I'm sure it was frightening as well, but we were all there going, wow, I wish I was worthy of the white coat so that I could be down there with them. So thank you.
Thanks.
Thanks, Anita. Okay, so Beth, you have been in the State House throughout all of this. Most recently, we had Mike DeWine actually did announce a replacement for Amy Acton end of last week. She was a doctor, another woman, immediately attacked, you know, within hours of the announcement. She ended up withdrawing and directly citing the harassment that Amy Acton had faced as her reason for withdrawing from that job. For me, it makes me worried. You know, I want a doctor in this job. I want a doctor leading our Board of Health through this crisis. You know, you witnessed these attacks on Amy Acton. I was personally shocked to see how partisan this became so quickly in the pandemic. I had, when the State House repeatedly voted to undermine her authority, the fact that every single Republican voted to do that each time, voted against requiring masks in the State House. Beth, you were here for all of this. Were you surprised that Dr. Duvay, this most recent Amy Acton replacement, ended up withdrawing so quickly? Have you been, just tell us, what has it been like to be a state legislator through this?
Yeah, I'm always surprised because I feel like there's, you know, there are facts and it isn't going away. We need to take it seriously, and from a health perspective, from an economic perspective, from an education perspective, all of those things come together in this issue, and we do need to take it seriously. So I'm always surprised. I do think that, unfortunately, Dr. Acton became the symbol of frustration, right? People, I think, did come together at first. Dr. Acton's voice was so strong and empathetic, and everyone was glued to the television and heard the message. And then it wasn't going away, right? And it was going to be something that we had to manage for a long period of time. And it's hard. I mean, we all know the changes in our lives have been hard. And so for some, it was, you know, I guess easier to look for someone to blame, right? We all try to look for a little bit for like, who did this or why is this happening? And there's no easy answer for coronavirus. It's a virus. It wasn't anyone's fault. But that desire to be able to say, no, it was this person or this thing. And I think that Dr. Acton represented that for people. And, it continues. I mean, every bill that goes through the Ohio House these days has some amendment to undermine the ability to contain the spread of the virus, whether it's to change the way we contact trace. Contact tracing just means if you get sick, health officials ask you who you've been in contact with and try to call those people and tell them, hey, you've been around someone who's been sick. But people, we've had a lot of amendments that try to prevent people from doing that. The mask thing, people in the Ohio General Assembly still typically don't wear masks, and some do, but from the majority party, all the Democrats do. But I don't know why it became so politicized that way. It is certainly frustrating. It's always surprising, but it's here, it's real, and we have to be smart about containing the spread for everybody.
I think it's so surprising to me because I'm not sure it comes down into such partisan lines within our communities, right? I mean, we see whether you're looking at like an opinion survey or just what we observe through people that we know. Mm-hmm. It doesn't seem like it's so partisan. Like you only wear a mask if you're a Democrat. Like, no, come on. Like we're parents out there trying to get through this thing. But yet when it comes to the politicians,
absolutely,
these Republican state legislators are out of step, it seems like, with the community that's not making it as partisan and just trying to get through. Is that what you see in your practice, Rachel?
Yeah, I mean, people wear their masks when they come to see us. They're fine with it. I mean, in my kids' school, the kids are wearing their masks, and my 6-year-old who made an appearance earlier, he's great wearing a mask. Like, he wears it all day, and
No big deal, Mom.
he's fine with it, and he doesn't think twice about it, you know. And it's just become so politicized. There was a lawsuit against the interim health director that was filed in the last several days by parents from a school district in Ohio, and one of the comments they made was, I don't want my child to wear a mask because mask is a political issue. I don't want my child to make a political statement at school. And I just found that so disheartening that we have made this such a government versus science kind of issue. And it's come from the top down. I mean, from the very beginning, we've seen this be the issue. But, you know, we've worn masks in clinic for years. Every time a kid comes in with a cough, I wear a mask. And this was prior to March. You know? So it wasn't like this is a new thing. Like, we've done this for years and we've known that it works. So it's just very disheartening that it's become such a strong political issue.
Yeah.
I also think there's a cross section here between racism, inequity, and politics. You know, I think as soon as, and I hate to point fingers, but I think as soon as the president realized that the people that were most affected by this were people of color, people that were sort of low socioeconomic, quote, essential workers, he lost interest. He decided it wasn't worth pursuing. And, you know, if you think about all these Bob Woodward interviews that are coming out, I mean, he clearly knew that this was a problem. He knew that it was airborne. He knew that, you know, people can die from it. And some of the statistics are saying even if 2 weeks earlier we had done some institution of social distancing and masks, or, you know, what we started to do and then didn't do, 90% of the deaths were preventable. I mean, think about that. You know, we all got so, I mean, there's been so much about 9/11 recently, 3,000 deaths, and we're at almost 200,000, and people are like, it is what it is, you know?
Mm-hmm.
And that's awful. I mean,
Except not everyone, you know? I mean,
Right.
It's like you get that reaction from the diehards, right?
Mm-hmm.
Who are on board with this politicization. But I actually think every time I hear that, you know, from the president, I just think, you know, you're creating more and more distance between you and the American people, like what we are out here experiencing. We all want the economy. We all want things to get back to normal. We all want our kids to be able to go to school like normal, you know?
I actually think that this is one topic that is a lot more nuanced and is a lot more that you have more cross thoughts across the aisle. You know, there are a lot of issues that, you know, do come out as very, very highly political. But I think there's a difference between what's happening among our elected leaders and the way that they're voting along party lines and what the broader community, you know, really feels. Because in the practice that I run as well, I'm in the healthcare field in my day job. We have patients that, you know, are just fine and understand all the precautions. And on the Dr. Amy Acton Fan Club, there are lots of conversations. And when it starts to get political, we've got a very, very vocal Republican contingent that starts to speak up and say, hey, I'm Republican and I wear a mask and, you know, I'm on board and I'm listening to doctors. So don't say that it's, you know, a political issue. But then we find in our state house, it really is. So it's interesting because I do see a disconnect between our elected leaders and the general population.
And our governor, I mean, I give him so much credit for how he handled this.
Absolutely.
Well, I think that that's what we're all seeking is, you know, in Ohio, representatives that represent the people, right? You know, and I think that, you know, for the most part, the people don't want these to be partisan issues. And so, and do want to respect science and listen to the medical experts. So the people are with you, ladies. That's what I believe anyway. I mean, we saw Amy Acton's popularity, what she meant to the people of Ohio. I think that is proof of that, to be honest. Okay, this is something, Rachel, you alluded to this earlier, but this comes up a lot in our group. So many women share their struggles in communicating with friends and with family who say, oh no, you're the ones who are politicizing COVID-19. It's not that serious. And I think a lot of that comes from fear and frustration. We all want it to be done. We all want it to be over. We don't want it to be this bad. We want it to be past it, and here we are, we're still in it. But how do you hear that from people in your districts, people in your lives, in your communities? And what advice do you have for responding to those concerns? And I mean the ones that are genuine, and as opposed to, just trying to politicize the situation. Beth, sorry.
Can you focus the question again?
Yeah,
Katie?
no,
I'm
sure.
sorry.
How do you respond to women often talk about struggling to communicate with people who say, no,
Oh,
you're making this a political issue. It's not as serious as Democrats might make it out to be. How do you communicate about the seriousness of this and sort of push back against the notion that you're the one that's politicizing this by trying to say this is something that's serious?
So I think that the advantage that the three of us maybe have is that we can really fall back on our focus on health. And certainly that's what I do in the State House. That's why I ran. I really have that lens to everything I see. And I think it's genuine to people, that people know that I'm really just trying to work for health and to keep people healthy, and obviously healthcare, but it's broader than that. But and so I do that and talk about my experience taking care of patients, because sometimes people don't really believe that people are actually getting sick with coronavirus. And I can talk about, I'm a hospital doctor, and I can say that I've seen a lot of people with this. And then they might feel like, well, maybe it's just they also had coronavirus. And that's not typically what we admit patients with. I mean, they usually are having problems breathing. And so I think that personal experience is helpful. Understanding intentions is helpful. If you can establish up front that you really are trying to be helpful, and then obviously listening, trying to really get a sense of where people are coming from, why they're believing what they believe. Where's it coming from? And if you can do that, if you can stay open to the meaning and the reasons for the questions or the reasons for the disbelief, I think you can have a good conversation. It's not quick. I mean, most of the time talking points sound good on television, but they don't really, they don't connect with people, which is the key here, is to build that trust and have a real conversation. Anchor it in the experience that you have. A little bit of data, if you can bring it. Most of the time, it's not numbers that really speak to people, though.
What about you, Anita or Rachel? What do you find that speaks to people?
I think Beth is right. The real examples. I mean, I have a friend, and you've all seen her on TV. She was one of the first doctors to get COVID. She has been speaking out. She was in the ICU for 6 weeks. So, telling people those stories. There's this nurse anesthetist I work with. 2 months out, she still has no sense of taste or smell. I recently saw a younger patient, 32 years old, never went to the hospital, but now is dealing almost with a chronic fatigue syndrome. She's got the COVID fog. She's like, I can't run up the stairs like I used to. I get short of breath. I have to stop halfway through, and these are real people. So yeah, the numbers don't matter. People don't, but when you hear the stories, when you hear the residual processes that are happening to people after having COVID, not just the ones who were in the ICU, but even ones who had milder cases that now are talking about the symptoms they're experiencing. I think those stories really resonate with people to say, oh yeah, this can happen to my neighbor. This can happen to my friend. My doctor knows these people that had it, and I think that's what's gonna hopefully, push the needle towards let's do masks, let's socially distance, countries, states where, I was in Boston, my brother lives there, everybody was wearing a mask, even out running, and I'm not used to running with a mask, and I did because that's what is the expectation. Here, the expectation is not to wear a mask when you're outdoors, so people look at you like, why are you wearing a mask? But there, it was almost like, why aren't you wearing a mask?
Mm-hmm. So Rachel, what about you? Do you see that fatigue, COVID fatigue? I think we've all got it, and how do you talk to people who are feeling that deeply?
I would just kind of second what the other said is really it's all about personal experience. So, there's been a lot of talk about how kids don't get this, kids don't get sick, and it's only a problem with the older population. But I have seen kids who've gotten sick. I've seen kids who have gotten sick and passed it along to their elderly grandparents. And so those are stories I think that resonate with people. It's just, the real life experience and just, saying what I know, and what I know is what I see, every day in clinic, and just trying to reassure them that, if we keep doing this, like look at the progress we have made since we have instituted the masks. I mean, that has made a difference, and social distancing, we've made differences. And so keeping it up means that hopefully next school year will look much different than this school year does. We'll be able to have somewhat more of a normal life. This is really what we all want. But we can't give up, especially moving into the winter months when we're going to hit cold and flu season. And it's going to be really hard to know, is this, a regular cold? Is it the flu? Is it RSV, or is this Corona? I mean, they all look very similar. So it's going to be a tough winter. So we're just trying to make sure that everyone's trying to be as safe as possible heading into that.
Thank you, Rachel, for saying that. I think it's true, and it's hard to look at, what's in front of us and to know that it could actually be even a little bit harder than where we are right now. And so I just appreciate that brutal honesty. That's part of it, getting through this whole thing. You guys, I want to wrap this up with just a fun little rapid fire round that we do, just because we always like to get to know you as people, as human beings, when we have these chats on Red, White, and Blue. But thank you for being here and sharing. I know you've given me more confidence as I talk to people who I know, the women in our network, as we might struggle through some of these conversations. I mean, being able to say, I just heard this from Dr. Beth Liston. I just heard this from Dr. Anita and Rachel. It increases our confidence to communicate about these issues that are hard and that we've never confronted before. So thank you. Okay, so let's see. Let's start with you, Anita. Rapid fire. One piece of advice you would give your teenage self.
Be more open to listening to people who know things. I think I, as a teenager, was pretty, thought I knew everything. And probably, at 16, you know everything, right? So I think I would tell my teenage self, listen to people who've been there, listen to people with experience.
Yeah. And look forward to that amazing wine glass that you now are sporting this evening, Anita.
Be open to new experiences.
Yes. Cheers to that. Okay. All right. Beth, for you, one thing you're just going to miss least about living through the pandemic.
The thing I'm going to miss least, I love Zoom events. And I'm an introvert, so I'm actually, I love the fact that we can stay home and chat with each other sometimes, and I'm not at an event every single night. So when things revert back, that will be something that I miss about the pandemic period, and I currently miss least about the changes that we've experienced.
Fair enough. So Beth Liston, not yet zoomed out. Like some of us. I am zoomed out. Okay. All right. Last one for you, Rachel. One thing you are grateful for right now.
Probably my kids, but also being able to be outside, being able to go take walks, and being able to be outdoors has been wonderful through all of this. So I'm grateful for that right now.
While we still can, everybody.
Yes.
Grab your wine, get out on your deck. We're on your stoop, whatever patio you might have. Well, you still can.
So there are outdoor heaters that you can look into.
That's true. That is true.
My husband just bought these microwavable warmers that you sit on. Highly recommend.
Yeah, I think we need to
keep that booty warm.
Because I think we're going to want to still be outside.
After all.
So think about
Yes, I am not originally from Northeast Ohio, but I am having to get tougher about the cold, and this is my year to really get rid of the wimpiness.
Surround yourself with heaters, Katie. It'll be good.
And hand warmers. Hand warmers help.
Oh yeah. Mm-hmm. All right.
Toe warmers.
Get my online order right now. All right. Such good advice to the very end, ladies. Thank you so much. And Deborah, thank you for joining me. Always love
Great
doing
to be here.
everything with
Thank
you.
you, Katie.
Okay, so I am going to pass the baton to Julie from Red, White, and Blue to reflect a little bit on this conversation and talk to all the women out there who might want to do a little more to get engaged. Thanks, everybody.
Thank you.
Hi.
There's Julie. She's coming on.
Hi, Jennifer.
Hey, Julie. Hey, Jen. How you doing?
Okay. I was going to say, I love having not one, not two, not three, like 5 amazing women on the screen at one time. That was so cool.
That's a
And
lot
I
of
like how they had to rearrange to get everybody up there because, you know, all these like amazing ladies there to talk. I thought that was great. So
Yeah, you know what? I have been missing Dr. Amy so much. I mean, it was pretty cool that I got to meet her in person when we delivered that thank you card for 20,000 Ohioans recently. But, you know, just the day-to-day presence of having a doctor being able to give us some guidance, someone who was listening and telling us hard truths and getting us through. I've just missed it so much. So that was good for me to get a dose of, like, you know, the women doctors giving me some words to live by.
awesome. Jennifer, your lighting looks good. She was worried she wasn't going to be lit up, but she looks great. So
It looks amazing.
yeah.
Oh, I look amazing. Yay.
Oh, come
Jennifer,
on.
you haven't been on before, so you should introduce yourself and tell them who you are and where you are.
Oh, okay. So I'm Jennifer Adamson Gill. I'm a new organizer with Red, White, and Blue, and I'm in Lyndhurst.
Which is where?
Well, so I'm on the east side of Cleveland in Ohio.
Yeah. So I was laughing at your conversation about the cold because I'm down in Cincinnati. I'm Julie Womack. I'm the organizing director for Red, White, and Blue. And I'm from Cleveland and it sucks in the winter, ladies. So you just, it's
Don't
a
hate.
little bit better
Don't
here.
hate.
You need to come to Cleveland and then, you know.
Yeah, I know.
Okay. All right, you guys. Oh,
We're going to
sorry.
chat and
Yeah, so I'm gonna let you guys chat. I know you're gonna bring on a couple other ladies. And anyway, always good to see you guys. I'll probably see you on a Zoom call like tomorrow too. But anyway, let's get lots of ladies involved. We have like less than 50 days till this election. We got to get everybody to vote early and get informed about who these candidates are. So, mwah.
right. Hey, you guys just saw amazing candidates who are running. We have so many amazing women who are running for office, and we need to help get them over the finish line. We need to use our voices just like they did, right? And do something. And so that is part of what Red, White, and Blue is all about. And that's why we like to come on and talk to you at this point. So you can see on the screen that we actually have an app that we use to help you talk to your friends, because you can totally influence your friends this election. And we make it really easy. So we really hope you'll get involved with us. You can download the Outvote app. There's our campaign code and get involved. And to be totally honest, if you guys do that and you're Heather Cox Richardson fans, she's actually coming on the show Thursday night at 7:30. And if you download the app and take an action, you get entered into a chance to actually come on here and get on the screen like us and actually ask her a question. I'm super excited about that. So many reasons to download Outvote tonight. But Jennifer, we were supposed to have company. I don't know what happened. So it's you and me, girl. So tell me, what did you think about the conversation? What like stood out to you from what the fabulous doctors were talking about?
Well, I have to say, you know, these women are amazing, and props to them for, like, you know, doing the work, right? And in the middle of a pandemic. I mean, I was like really inspired to hear from them, and they've got a really tough job. You know, these women are amazing, and props to them for, like.
Oh, how we have Susan.
Hi.
All right, Susan. I'm going to let Susan introduce herself. Do you have sound, Susan?
And props to them for, like.
All right, you finish your thought, Jennifer. Go ahead.
No,
we can't hear you.
It like keeps repeating what I'm saying. I don't know why.
Yeah, I'm getting a little bit of back, whatever that's called, there too. All right. Well, what stood out to me, number one, I really thought it was great when they were talking about how you should look at what the international scene is doing, because that drives me insane. I keep seeing people who are saying like, oh, this is a hoax or this is made up. And I'm like, do you really think the rest of the world is just dropping their economies and closing schools to help the Americans defeat Donald Trump? I'm like, that doesn't even make any logical sense to me. So I found that to be kind of interesting. But I don't know. I see this in my life every day. I see people online posting about not wearing masks. I've heard kids at my daughter's high school who have already like tried to defy the mask order. Have you guys seen this around you? I know your kids are younger than mine, Jennifer, but have you seen that or had to deal with that?
I mean, we're really not going out that much. So, I've been spending a lot of time at home. So thankfully, I haven't had to take my kids to school or, we spend a lot of time at home.
What about you, Susan? Do you have sound yet?
How's this? Can you hear me chugging?
Yes, I can hear you. All right. What about you? Have you had experiences that were negative because of this whole I can't even say the word. Oh my gosh, I really can't say it. Politicization.
Yes.
Politicization.
I know what you're talking about.
The politics around public health. Yes.
Yeah.
Okay.
It's from unfriending people on Facebook who, again, they weren't in my immediate circle, but they are science deniers. We don't know that yet. I'm like, what do you mean we don't know that yet? What frustrates me is that, we have all learned so much as this virus has progressed. We've learned, every week, every month, doctors and scientists are finding out more about it and hopefully sharing that information with us. But it's like there's a segment of the population that won't cut science a break. And because the evolution of knowledge has changed, their response is, well, they didn't say that in the beginning. That's not what they said at the start. Right. They don't know if masks. I'm like, no, they know. They absolutely know. And so that's what this inability to stay in the light and remain educated about it and accept that it's a change. Everything's changing about this and we're learning more, but the inability to accept that is fact. And I think, I can't remember which physician said it, but I think it was Dr. Somani. It comes from the top. And that's so maddening about it.
Yeah, I was going to say, I totally agree. I feel like all these kids, we want our kids to go back to school to learn science. And then everybody is forgetting what science is all about is proving theories, and you find out things that are right, you find out things that are wrong, and a brand new virus, you don't know a single thing about it. You're doing your best guess with the best information you have, and then you keep studying it. I'm like, this is what you're teaching our children in school. And then you see people just completely ignoring all of that online, on Facebook. I don't know. Do you have that in your circle too, Jennifer? Do you have people you've had to block or unfollow or even unfriend on Facebook?
My go-to move right now is the snooze, the 30-day snooze. I'm sure you're familiar.
Yeah.
So that's kind of my go-to. And I'm just hoping that, maybe we'll get past November 3rd, that kind of stuff. Typically when people come around and they start talking about how it's the flu, then you're like, okay, I know that maybe you're denying the science behind all of this. So that's normally when we hit the snooze button.
Yeah, to be totally honest, that's the one that really drives me nuts is the flu, because I'm like, at 200,000 people. I mean, even in my, I'm like, even in the worst years of the flu, we are way, way past that. So I always kind of look at people when they say that, and I have a hard time understanding that. I don't know if you guys heard the one thing that the one of the conversations was about the lawsuit and the mom who said she didn't want her child to wear a mask because she didn't want them to be political. And I was like,
yes.
Are you kidding me? That's a political statement at school now?
In the last week, I have gotten voicemail recordings from my friends in Finland and one of my really dear friends, and she's Danish, and we chatted, FaceTimed for 30 minutes on Sunday. and she's been to the US. She was an exchange student here. She's been, her kids went to some college here. So they've been here a ton as a family. And she's like, what is going on over there? Like, I don't understand how we thought America was a leader in science and a leader of the world. What's happening? You know, I'm like, yeah, your guess is as good as mine. I know what's happening, but it's like, this has just, our reaction to this virus has just degraded our standing in the world. And I forget which doctor said, watch the BBC. It's not and we do that. We'll watch the BBC and you see footage from other countries all over the world. We're all dealing with this. That's why I just want to like strangle people and to watch the BBC for an hour.
What?
No, I totally agree. Actually, that reminds me. I have a friend who is American and moved to Canada. Her husband's British, and I always see her posting online. I love listening to my international friends or at least friends who live abroad, and they post because they do post that exact perspective that they just look at us and think we're crazy. And she actually became a Canadian citizen, a dual citizenship with the US. And she's told me that she now travels on her Canadian passport because it is just less crazy.
Oh,
like so many less issues when she travels on her Canadian passport. So
we feel her, yeah.
Yeah, no kidding.
I don't
feel
want
her.
to passport. Like,
all right. So we want to wrap this up. I just want you guys to know that if you guys feel as crazy as we do with having to, like, what did you say, mute people or lose people, if you have to unfollow, if this whole public health and ignoring science is driving you insane and you want to see some changes in Ohio and at the state level, at Ohio and at the federal level, then we need to do something, ladies, because it's going to take all of us to do that. So we really, really need you to get involved. And we promise that we will help you, and you can definitely send some fun, interesting videos, funny videos featuring us. You'll see a lot of us in these videos to really explain some of this stuff and really inform and influence your friends before November. So I hope you'll get involved with us. The information is right there on the screen about the Outvote app. We would also definitely want to see you here Thursday night to see Heather Cox Richardson. Again, another fabulous lady based in facts, which is called history, right? Who lays it out for us all the time.
Wow.
What a concept.
Wow.
But we are so glad you guys came tonight and hung in with us, and say cheers to everybody out there. Have a good rest of your evening.
Cheers.